Doc on the Run. We help injured runners run.
Now today we're talking about why doctors misdiagnose runners. All I do is talk to runners who are injured and want to run. And 99% of the time when a runner calls me for advice, it's because they aren't getting better and they want a second opinion. Well, much of the time, the runner has been misdiagnosed. If you don't have the right diagnosis, you will be doing the right treatment for the wrong problem, and you're not going to get better. In this session, we're going to talk about the top 6 reasons doctors come up with the wrong diagnosis when you're injured. Okay, so the very first reason that doctors seem to come up with the wrong diagnosis when they've seen somebody who's a runner who's been running, training, they did a marathon, did an ultra marathon, whatever, and they get injured, and then they go see a doctor, and the doctor makes the wrong call and says that you actually have a condition that's not really the thing that's bothering you. Well, the number one reason that happens is that your injury sounds typical. So what do I mean by that? Well, if your running injury sounds typical, then it misleads the doctor. So whether you know it or not, you think that you come in and you tell the doctor your story, and then your doctor looks for the problem, and that the story that you give, the history, the stuff you write on the intake form when you go into the doctor's office, or what you tell the nurse when you walk into the doctor's office, you always think that that's a precursor to the doctor figuring out whether or not you have a specific running injury. But the truth is that the history is the most important component of a runner's diagnosis. So when you tell your story, the doctor comes up with a list of probable causes of your injury, your complaint, whatever, and then basically the physical exam that they do when they actually start poking and prodding on your foot, well, that's just part of the process of ruling out some of the things on the list. If you're ramping up, you're increasing your mileage, you get this aching pain in your foot, and it seems to correlate directly with that increase in mileage, most likely thing for sure is a metatarsal stress fracture. It's not the only thing, it's just the most common thing. You might have been told you have a neuroma, but you have a plantar plate sprain, or you might have been told that you have a plantar plate sprain and it's a neuroma. But the reason for that most of the time is because the doctor hears what sounds like a convincing story that fits very, very closely with what we expect for that particular condition. You have to go in knowing that there can be a lot of different conditions, and if you don't respond to that treatment, of course, then you probably have been misdiagnosed, and maybe it's because your story just sounds so much like the diagnosis you were given. That's reason number one. Now, reason number two is that you don't get a chance to tell the full story. So again, when you go in and you start telling the doctor, okay, hey, I was ramping up for my race, I started getting this aching pain in my foot, and the doctor listens to you and thinks it's probably a stress fracture, and then says, okay, well, I know what's going on. You're a runner. You guys are nuts. You run way too much. You shouldn't be running all the time anyway. 100 miles is crazy. A marathon is crazy. Why would you want to do that anyway? Why do you ride a bike instead? And they just cut you off, and they've already then, at that point, of course, already made several conclusions about you. Number one, they think you're nuts. Number two, they think you shouldn't be running. Number three, they think that you're going to want to ride a bicycle or swim as much as you want to run, which of course is not true, but they don't understand you. They don't understand you're a runner. So, the doctor cuts you off, doesn't hear your whole story. They've already decided also that based on the little part of your story that you gave them, that you have a stress fracture or plantar fasciitis or some other problem. You have to finish your story. And if your doctor doesn't hear your whole story, sometimes they'll come to the wrong conclusion just based on these little bits of your story that they think are the most relevant. But you got to have a chance to tell the whole story. That's reason number two. Reason number three is actually a little confusing to patients sometimes. Reason number three is that your foot actually hurts too much the day you go and see the doctor. So if your foot hurts too much the day of your doctor visit, you can confuse the doctor, believe it or not. And now, an ankle sprain is probably the best example of this. You're running down a trail and you just hit a root or rock, or you slip on a switchback or something, and you roll your ankle. So you roll your ankle, it hurts, you limp through the rest of your run, and you get home and then it swells up like a balloon later that day and you can barely run on it. So you go to the doctor and your doctor looks at it and pushes on it. Well, the first thing they're going to do is try to figure out whether or not you broke anything, because that does happen. You can break your ankle if you roll it too hard, and if you do that, then obviously the treatment's different than if you just sprain your ankle. So the first thing the doctor is going to do is try to check and see whether or not you might have a broken bone. Now, there's a specific set of rules that we all follow to determine whether or not you might need x-rays when you sprain your ankle. They're called the Ottawa ankle rules, but the details of them aren't important. But the important part is that one of the components of the rule, for example, is that if you push on the fibula or the outside ankle bone on the side of your foot and it causes pain, then you should have ankle x-rays to see whether or not there's a broken bone. If you have an injury and you're thinking about going to see a doctor, but you push on your foot and it hurts in all kinds of different places, then you're going to mislead your doctor too. If you want to simplify that, you can basically just do something like soaking your foot in ice water, doing the contrast bath routine, just applying some ice, whatever, elevating, using compression socks. Do something to reduce the inflammation before you go into the doctor for that visit, because if you have tons of inflammation, tons of swelling, and tons of pain, your doctor's going to have a hard time figuring out what the one problem is that's really bothering you. And with most runners, it's one problem, it's one thing, it's one injured structure. So try to get some of the inflammation in so that you won't have that problem that will lead to a misdiagnosis. Now, the next problem is that your foot doesn't actually hurt enough when you go into the doctor. Now, if you've had an injury that's kind of been nagging and it kind of comes and goes, it really crops up when you do races, or it really kind of pops up again when you're doing a speed workout or a long run, but then it subsides and you can continue to train. Those subtle injuries sometimes are difficult to diagnose. The reason for that is that the main thing is the doctor listens to your story and tries to figure out what's going on. Once they hear your story, they kind of come up with this, list of things that it might be, which we call the differential diagnosis. And then after we have our differential or our list, we start poking and prodding on your foot, checking for muscle strength, checking if we push on tendons, checking to see what hurts when we mess with your foot, and then we try to make a conclusion about what's really wrong with you. So if we push on a structure and it doesn't hurt, we assume there's nothing wrong with it. So that's the problem, is that if you have a really subtle injury and it's not really bothering you, the doctor might push around and then they say, I don't really know. I don't see anything wrong. The same as how the mechanic couldn't figure out what was wrong with the door seal on my car. So, if one tip with that is that if that's the case, if you have this really subtle thing, if you can push on your foot and you know where it's sore, well, that's not a problem. That's going to be easy. But if it's been several days since you've been running and your pain has really gone away and you push around in your foot and you yourself can't push on that spot and find something that really reproduces your symptoms and causes the same kind of pain when you run, then it may be difficult for the doctor. So in that case, what you can do is you can go out maybe before you see the doctor and do a short run. Do it the day before or do it the morning of the appointment or something. But, don't go crazy. Don't go run 30 miles. But if you know that running just like 2 or 3 miles will make it a little bit sore and you do that the day before or the day of your appointment, then it may make that subtle injury kind of flare up just a tiny bit. Not enough to do some damage, but maybe it'll make it flare up just enough that the doctor will have an easier time finding the one structure that's really messing with you and causing your pain, because you've got to get the right diagnosis. So the next reason, the fifth reason that doctors make the wrong diagnosis or a misdiagnosis when they see you is that they don't examine your foot closely enough. Now this one to me is the only reason on the list that is really totally 100% inexcusable. I just don't get it. I do second opinions with people all the time where I will see the patient. The patient will tell me they saw someone. I know who the person is. I know they're reputable. I know that they're qualified, everything else. And they will say to me, the doctor never looked at my foot. I actually never even took my shoes off. The doctor heard so that comes back to kind of one of these earlier ones, right? The doctor hears your story. They make a snap decision. They're like, oh, okay, this is just plantar fasciitis. So-and-so is going to give you your instructions. We'll see you back in 6 weeks. And they don't even look at you. So that is really a problem, and I think it's inexcusable. So you're going to the doctor to get expertise. You're going to get somebody who can listen to your story and come up with the most probable thing based on your story, and you're getting someone who has a lot of knowledge, experience, and training at looking at your foot, pushing around, testing things, trying to figure out what the real problem is based on the physical exam. So, that is one reason that I think when you go to the doctor, if you're there and you have a problem with your foot, and your doctor doesn't look at your foot, you should stop the doctor and tell them, aren't you going to look at my foot to make sure, absolutely sure, that it's not something else? And even if your doctor seems confident, don't take that as an okay thing. Just tell them, look, I want you to just look at it just to be sure. Are you sure it can't be something else? And then, and that sometimes can help, because many times I think when people have been misdiagnosed, if the doctor just looked a little bit closer, taken a little bit more time, they could have figured it out. So that brings us to the last reason. Now, reason number 6 is that your doctor's in a rush. Now, I'm sure that every single person listening to this has had an experience where they went in to see a doctor and the doctor was in a rush and they got the wrong diagnosis. When you have something, like what seems like plantar fasciitis and the doctor's in a rush, trust me, you're low man on the totem pole. And you go in like, oh, it's just plantar fasciitis. If you just run a little bit less, it'll go away. But then it doesn't go away. So months later, you're still scratching your head trying to figure out why you've got heel pain when you step out of bed in the morning. And it's because it's not plantar fasciitis. So the doctor gave you the information for plantar fasciitis, and then the assistant came in and explained to you what to do about it. And you've been doing all that stuff religiously, and you're not improving. And you're confused. Well, that's because you had the misdiagnosis based on the fact that the doctor was just rushed. The doctor was in a hurry, didn't really figure out what was wrong with you, sounded like something common, and then they sent you on the way with the wrong instructions because they got the wrong diagnosis. So that's the thing. You need to make sure that these things happen. You need to understand that they happen. You make sure that it doesn't happen to you above all else. So whenever you go into the doctor, make sure that you give them the full story. Make sure that you slow them down and give them the rest of the story, even if it seems like they've already switched on to, that whole, like, I've already made a decision process. And make sure they look at you, examine you, and they know where it really hurts on your foot so that you don't get a misdiagnosis. That's the crucial part. So just remember, when you go into the doctor, you need to get your questions answered. You need to not let them rush you along, and you need to make sure you get the right diagnosis. So if you go in and you get the right treatment for the right problem, you're going to get better. If you've been diagnosed, you're not going to get better. So if you've been diagnosed and you like the doctor, you trust the doctor, but you're not getting better, you only have a couple of options. Either see somebody else, get a second opinion, or go back to the doctor, call the doctor's office and just say, look, I'm doing all this stuff. I'm really doing it, and I'm concerned that I don't have the right diagnosis because I'm not getting better at all. I'm not improving. And it's totally fair to do that. So you have to make sure you stay on track. Remember, if you get a misdiagnosis, you're not going to get back to running because you're just not going to get better when you're doing the wrong treatment because you have a completely different problem.
Doc on the Run. We help injured runners run.